Hi, I'm Dr. Iresh Shetty. I am a consultant cardiothoracic and vascular surgeon at KMC Hospital, Mangalore. So, robotic cardiac surgery is another new technique that is used for cardiac surgery. It has been around for the past 10 years. It is mostly called as robotic-assisted cardiac surgery, wherein there are certain parts of the procedure that are performed by the robot. This again can be done for most patients, but they have to fulfill certain criteria, the same as in a minimally invasive cardiac surgery. The patient can't be too obese, can't have had previous cardiac surgery with bad scars, or shouldn't have undergone previous radiotherapy. The surgeries that can be performed via robotic assisted cardiac surgery are bypass surgery, of course certain valve repairs, and certain hole in the heart closures, which are called as atrial septal defect closures, that can be done in small children as well. All these are amenable for robotic cardiac surgery, but again, if and only the patient fulfills the criteria that are required for performing these procedures.